Good afternoon and welcome, everybody. I'm Casey O'Brien. I'm the Executive Director and Principal Investigator of the National Cyber Watch Center, and I want to welcome you to this month's installment of our ongoing webcast series. We have it's going to be a real treat. We have Stan with us today. He's going to talk about situational and cybersecurity awareness for public health researchers. And before I turn it over to Stan, I just want to mention a couple things, and one is just a little bit about the National Cyber Watch Center and my sort of, I guess, personal connection and affinity to this presentation. So the National Cyber Watch Center has been around since 2005. We are a cybersecurity education, workforce development, and research consortium headquartered at a historically Black college, Prince George's Community College, outside of DC, Northern Virginia, sort of Maryland, where they all converge, Largo, Maryland, where the Washington football team plays. And we started with 5 two-year schools and 5 four-year schools. And the whole purpose of the consortium was to try to develop a higher education capacity to churn out students that could move into, even back then, high demand information security jobs at that time in the DC metropolitan region. And over the past 15 years, our network has grown to some 400 2- and 4-year schools and a number of programs, most notably degree and certificate programs for 2- and 4-year schools to adopt and adapt, and lots of dissemination activities like this webcast series and various research publications and whatnot. So that's the National Cyber Watch Center, and we've been doing this webcast series, I think, geez, going on 6 or 7 years now. And personally, from the Midwest originally, but moved to Baltimore in '95 to work at the Johns Hopkins University Center for Communication Programs, which is a world-renowned health communication organization that that primarily, and still for the most part, does uses various sort of mass media communication techniques to deliver family planning programs in developing countries. And I come out of a psychology background. I don't come out of a public health background. I was a statistician, software programmer, and fell into this sort of public health world. And I was telling Stan before we started this. This is back in the old days before Michael Bloomberg had given his first of two $50 million gifts to Johns Hopkins, and it became the Bloomberg School of Health. Back when Stan said, you really had to hustle, right? Had to work for it. So, and I really really valued my experiences and time, doing that health communication work. And so I'm just personally really thrilled that we can bring this topic to you all. And Stan was telling me some of you all that have joined us are not cybersecurity people, and that's fabulous. That's great. And that's sort of one of the main goals of this webcast series, is to bring subject matter experts from industry, academia, government, workforce development, you name it, together to share topics of interest. So a little backstory about our center and why I'm personally really excited for this webcast today. So just in terms of the rules, video's not necessary. Stan said he hasn't seen some of you all in a while, so you may want to turn on your videos just so he can see you, but not necessary. At some point, I'll turn my video off. And of course, everybody's doing a great job of keeping their phones or their microphones muted when you're not wanting to ask questions. Speaking of questions, we absolutely will leave time at the end for questions, or if you have them throughout, feel free to use the Zoom group chat feature to go ahead and post those questions, and I'll be watching those and helping Stan out. This series, as I mentioned, has been going on now for close to 7 years. It's the last Thursday of each month. We record it, so we are recording right now. We will then clean up this recording and make this available on the National Cyber Watch Center YouTube channel. And once that's been posted, I'll use the same system that we used for you all to sign up for today's webcast to send out a message letting you know that the slide deck and the recording is available on our YouTube channel with the link to go get that information. We've got a lot of great topics lined up for the 2021 series, looking at things like competency-based mastery learning, cybersecurity programs, for example. So stay tuned for the topics that are going to come out for the 2021 series. So transitioning out into today's webcast topic here, you can see produced by the National Cyberwatch Center. I'm the moderator. And before I turn it, actually, let me go back one. Before I, let's see, let me go here. Before I turn it over to Stan, who is the director and cybersecurity lecturer at Keene University and their Center for Cybersecurity, I want to say a couple things about our 2020 Innovations in Cybersecurity Education Program, and it relates specifically to the presentation that Stan's going to do today. And I've got some notes over here on this other monitor. So if you see me looking over here, I'm looking at my notes. So a couple things about this program. First of all, you can see a link there. And once I'm done talking, I'll post that link in the Zoom group chat. But one of the strengths of the National Cyberwatch Center is our ability to aggregate and disseminate the capacity and creative experimentation found in our academic network, which I mentioned is almost 400 2- and 4-year schools evenly split throughout the US. And this program, the Innovations in Cybersecurity Education Project, is part of our awards and recognition, project. And it was built on the premise that our members are some of the best cybersecurity educational innovators, and that through our center, they can share their innovations, we can accelerate their adoption, and folks can receive proper recognition for their work. The first 2 years of the program, 2017 and 2018, all submissions were put into a publication. You can see on my screen there this year's publication. In 2019, we started to emphasize quality over quantity. So we had a panel of judges and we adjudicated submissions, and we did the same in 2020. And in total for 2020, we had 53 submissions, which was up from 47 in 2019, of which we chose 40 for this year's publication and a dissemination program that includes promotion through things like this webcast series and wraparound social media. There were 53 submissions, and as I mentioned, and of those 40 were selected across 4 categories: evidence-based strategies, instruction, practice, and program development. Stan's submission won in the practice category. And in addition to the publication you see and the wraparound social media and e-marketing efforts that will continue throughout the year, we also honored the winners in each of those 4 categories at our annual Community College Cyber Summit, which was obviously virtual this past August. So Stan's 2020 submission titled Situational and Cybersecurity Awareness for Public Health Researchers, as I mentioned, won in the practice category. And he's going to get into this effort that focuses to bring greater cybersecurity awareness to the global public health research sector. And I'm sure he's going to talk about the various folks that helped make that, this effort possible. So Stan, I'm going to stop sharing. I'm going to turn it over to you. And
alrighty, let me share my screen and we'll get this kicked off here. All right, can you see that? Can you hear me, Casey?
Perfect, loud and clear, looks great.
All righty, well, thank you, Casey, and really happy to be here. And I thank everyone for joining late on a Friday, well, not a Friday, but a Thursday afternoon at 4 o'clock. And I know I'm standing between you and perhaps supper. And so I think I'll be speaking for about 30 to 35 minutes. And, stop me at any time if you got questions. But, for me, this is a conversation, and I'm really just happy to be here and enjoying this. Let's see. So as Casey said, we'll be speaking until 5 p.m. I want to first start off with a big thank you to Casey O'Brien and his team at the National Cyberwatch Center. When I started here at Keene University not too long ago, I started, to try to feel my way and find groups and organizations and networks where I can kind of learn and get to know the landscape a little bit more. And Casey was extremely helpful, and his team was very helpful in providing me information, support, and responding to emails when they probably get thousands of emails because they deal with so many colleges across the United States. My hat's off to Casey and his team. They've been fantastic, and I just feel lucky. So let's see, here we are. I am here at the Kane Center for Cybersecurity, and yes, that is an office. One day, I hope you'll be able to visit us, and I'd love you to come to Union, New Jersey, and visit us at Heinz Hall and come see me at our offices and our Center for Cybersecurity. That day will come. I don't know exactly when, but right now it's limited. You can't certainly just come here. But I say with open arms, please, you're welcome here to the university when the time permits. Let's see. Our Center for Cybersecurity, we've got a fantastic team here. Our leadership, James, Dr. Driley, Dr. Morial, a very interesting group and setup for our Center for Cybersecurity. Dr. Driley's from the Criminal Justice. He's the Executive Director of the Department of Criminal Justice. And Dr. Moriali is the Executive Director of the Department of Computer Science. So what we've done with the center is we've got two unique departments and colleges working together on cybersecurity issues. And I think that's an important element and it distinguishes our center from other such centers. Other members, we have Dr. Liu, Dr. Zernarain, we've got Noella Diplan, Nancy Amador, and myself as part of the center. And we've got students every semester that we work with. These are student workers, and we're, who lend a lot of work into our efforts, and they change from year to year as well. Let's see, we've got 9 blocks here that we're going to cover in this agenda, sort of like 9 innings in a baseball game, but it's not going to take as long as a baseball game, okay? Although the games, I think this year have been a little quicker, right? Given the pandemic and less fans and people running on the field and stuff like that. So we'll talk a little bit about myself for those who may not know me, just really quick. We'll get into public health research background just a bit for those who may not be familiar with what it is in regards to this presentation, why it's relevant, why is this topic even relevant, introduction to cyber risk assessments, a proposed cybersecurity framework, a call to action for this work, and a call to action to further the framework development, and then we'll end with some questions and answers. Okay, a few things really quick about myself, just so you know. I got just over 25 years of IT experience. I started, just so you know who's talking here, right? I started off as a software developer at the package delivery company, UPS. Very grateful to them. They got my start in a development environment and an organization that really promoted education, training. And if you rolled up your sleeves and continued to work hard, you got more opportunities. So I was grateful to them. I then spent quite a few years, which is most relevant to this presentation, with a very large NGO headquartered in New York City, right across the street from the United Nations. From there, I moved on to the state of New York MTA Police. And in that role, I was charged with their application security lead, which was a very valuable experience for myself. And also I'm a member of the FBI InfraGard, and I'm also a board member. I think we may have a few people on this call from Venue Foundation. It's a nonprofit, small nonprofit, but they're getting bigger and quickly. And it's an organization that focuses on empowering and educating pharmacies and pharmacists in the developing world. And it's very important, the work that's being done there, because it's in many parts of the world, the pharmacies are the point of contact for healthcare, right? That is for citizens. It's extremely important work. I was mentioning to Casey before, I've done on the ground work in many countries over the years. And, and I think that's lent itself to be able to speak to you here today about how we take that forward with regard to cybersecurity and public health. So, and Casey was right in the beginning. He said that, I'm grateful to a lot of people. In addition to our Center for Cybersecurity staff, we had additional and crucial contributions to this effort from the Venue Foundation, led by Tammy Allen, Samir Sweetie, who at the time of one of our papers was studying for his MBA at Indiana University. We had Dr. Samia Ramarao at the Population Council, Dr. Jung and Dr. Yun from Kane University. They all helped. You can't do this stuff on your own and alone. And if you do, it'll probably take a lot longer and not be as fun. And that's why I emphasize fun. I think the more that we get involved in, working together, it certainly just makes it, for myself, I have to say, and I bet for many, just makes it fun. So a little bit about public health research, right? So mHealth examples, mobile health. For some of you who may not know, this is just one, I pulled this out of a paper, right? Smartphone-based contingency management intervention. Hold on, I gotta move this screen. To improve pre-exposure prophylaxis adherence, pilot trial. Key here is smartphone, pilot, mHealth, right? Technology being used in public health and lots of pilots, right? Which means examples of, smaller case studies, test cases, smaller segments of the population trying out these solutions. But that also to me means you need to be sure that you're not putting and exposing any sort of cyber risks, because you want those pilots to end up learning and growing and getting bigger and bigger and going to scale. Here's another one, feasibility of postoperative mobile health monitoring among colorectal surgery patients. Another example, and this is part of a thesis and dissertation repository. I just pulled this out, and again, use of mHealth technology and monitoring. It's basically a monitoring tool to advance patient care, all right? These are some examples. Other examples, and you might be familiar with these already, but these are digital health devices. So bottom right, many of us might be using tracking applications today as we want to enter a campus or a building or a facility. We just hosted a training on drones, providing FAA Part 107 training at our Kane Skylands campus a few weeks ago. And we had emergency responders and students there for this drone training. And as part of that, we needed to ensure that those who were coming on campus had to clear and answer some health-related questions, and as well as other protocols. But we were using a smartphone app. That's a digital health app. It's a digital health using a device for that purpose. Here's another one right in the middle. You might be looking at heart rate, right? There's lots of different heart rate apps that you can use with your smartphone. And again, that's the use of a digital health device. We're starting to see more and more of these devices being used. Another example, here we go, top left, it looks like a fingerprint reader. Well, it is. It's a fingerprint reader connected to a computer, and identity management is critical in many studies. In the case of clinical trials, for example, it's important that you have the right individuals and that there's no mistake about who is involved. And so we're seeing digital health devices that don't look like computers actually getting introduced more and more. So that's another example. So for those who may not be familiar with digital health devices, I want to give you kind of a broad example here. Here's another one in the bottom right. Gentleman's got a camera, a little device hooked up to his camera on the phone, and that's doing an actual assessment of his mouth. Now, you might see these used more and more today because of the use of telehealth, all right? During this time of the pandemic, you might be on the phone or on the computer or on your tablet and being asked to provide some information to the medical professionals. And again, this is a certainly an important element, but it is a digital health device and solution, okay? Other ways of using digital health. This is a self-report surveying solution, and I was personally involved in creating this. And what you see here, it looks like you know, sort of a comic in a way. You know, this is a cartoon comic, but this was giving individuals the ability to create their own avatar for a survey that would follow them through the survey. Now you may think, well, what's that got to do with health? Well, the questions that were being asked were health-related survey, questions around adherence, acceptability, those sorts of things to a medication or process. And so again, this, you may think, well, that's not really digital health, but it is in a sense, because we're collecting sensitive information and information that may include data that you do not want to get exposed. So this, you know, this utility, which allowed individuals to create a digital representation of themselves or someone they wish they would be. I think I would pick something kind of cool. I don't know, maybe I'd put long hair on myself or something. I don't know, just to make it interesting. Another example, this is was used in a study that I was involved in as well, around asking questions, sensitive questions to participants that may not be able to understand reading and writing, but they can listen. So they might be listening to an audio question and responding to questions by hitting color-coded boxes or pictures of fruits and vegetables, for example. All right. Most recently, this is another example, and this is one of the projects that led to the this idea of pursuing cybersecurity in digital health projects. And this was a project that I worked on with the Venue Foundation, and this was what was used for this current paper we have in final review around cybersecurity risk assessments. But this is with, we prototyped a chatbot for use in eHealth. And so we documented and went through a process of determining whether chatbots could be used in as an eHealth solution. So think about, these are some questions around diabetes care. So you initiated a question, you are then led through a series of different questions depending on the responses to previous questions, and you're then getting an automated response. And now chatbots have been used very often in customer service, in sales. I mean, for anyone who's gone to, back in the day when you can actually, if you were to go on vacation somewhere and go to an airline website, or I don't know, a theme park website, you may get a chatbot that pops up in the bottom right of your screen that begins to ask you questions. Do you need assistance? What do you need help with? And it's an automated system in the back end with some artificial intelligence that's actually responding to you. So this is another example of using technology or electronic health via chatbots. Other areas, case report forms. For those of you who might be familiar with trials, they're often used to collect all sorts of information, and there's been a movement in some areas of the world where paper has been primarily used. We're using electronic CRF. So again, using a application on a smartphone or tablet, and you're collecting information about the trial. This could be information about the participant, how they're feeling, similar to our trackers today, or other sensitive type questions, which you really wouldn't want to get out into the public unknowingly. Quickly, because Casey mentioned, he mentioned Johns Hopkins University, and two projects that I worked on where I was very fortunate to travel to Malawi and also to Uganda for a research project where we implemented electronic health surveying solutions. So I just wanted to give you an idea that this was actual work that took place, which kind of led to considering cybersecurity. Okay, that is a rhino that I really did wrestle to the ground, and this was in Nairobi National Park. And yeah, just I figured it's late Thursday, and I'd throw in a little picture of myself. But I will mention this, because just a little bit of a sidebar. A safari reminded me of fishing. right? When for anyone who's ever gone fishing, you get your pole ready, you put some bait on the pole and you cast it and you hope you catch something. Well, a safari to me was similar to fishing. You go out in a vehicle if you're lucky, or perhaps you may walk through a safari. But if you see a lion, you caught the big fish, right? That's what you're aiming for, to see an actual lion in the wild. All right, back to business. Or maybe we shouldn't go back to business. I don't know. Let's go back to business. All right, why is this relevant? Well, digital health technology is extremely important, and it is a catalyst to assist participants and patients without access to care. It's got enormous operational benefits. Just look at this number, right? Over the next 2 years, it's predicted to double to about 130 billion. And this was a pre-pandemic projection. And I put that clarifier here, pre-pandemic. I think some of you may have begun to see these already, these clarifiers about pre-pandemic projections. And quite honestly, I make a sort of a comparison with pre and post 9/11, right? So this idea, well, that was pre 9/11 or post 9/11. Well, we're starting to see information being made available, and this note often assigned to it, whether it was pre or post, because it could make a difference in the current time. Telehealth, no, I mean, goodness, this is probably not of a surprise. 2019, 11% of patients used. This is from a survey from Intertrust, up to 46% 2020. I would have expected that, but it's good to know. But what are some of the risks, right? 85, and this is from the Verizon Mobile Security Index report, 85% of healthcare organizations acknowledge a security breach would compromise patient care. Okay, and 37% of those same organizations admitting sacrificing mobile security to get the job done. That's important. There's a rush to get a system out the door or a pilot application out, into the public, maybe a bit too soon sometimes, and it's admitted by some healthcare organizations. They, sacrifice security. But what can that do? All right, so what? So what is the security issues? What can actually happen? Well, credentials, login credentials could be stolen and used. Patient data could be exposed if a system was compromised. System solutions, this is important, right? Intellectual property. I don't think we want, if we're an organization that's come forward with something that's unique and powerful and solves a problem, we don't want that information getting exposed and that knowledge that we worked so hard to gain. Integrity of data captured would be at risk, and interference of the system operation itself. All right. Vulnerabilities. This is an interesting survey for those who may wonder, and maybe you know this already, but this was another Intertrust survey that was done, a security assessment on 100 publicly available mHealth apps, and 741 vulnerabilities were discovered. And across all categories, they had several categories: health commerce, telemedicine, trackers, medical device apps. That's a lot. And I think we can do a little bit better when it comes to releasing these applications, with doing a bit more in a way of checking them for security issues. All right, and so who cares again? Why is this relevant? Well, let's think about the current environment. A major California university working on a COVID-19 vaccine was targeted by cyber criminals via ransomware. All right, that's not good, right? We got folks working hard to come up with a vaccine, and we got to fight off and fend cyber criminals. Another interesting case in Canada, a contact tracing app that was an official app being released in Canada. A masqueraded app was released ahead of time, and it spawned ransomware. So those who downloaded and used this masqueraded contact tracing app actually installed and encrypted their devices. So vulnerable people and systems are at risk given the opportunities COVID-19 has presented. Goodness, I mean, it's continuing. Just today, there was a release, a warning that was released from the FBI and the Cybersecurity and Infrastructure Security Agency and HHS, a warning to public health and the healthcare sector for known cybersecurity activities. It's continuing today. Health data is a favorite target for cyber criminals. Some estimates underground market pay more. They pay more for health insurance credentials than credit card numbers. For those who may understand this market, this underground market of buying credentials that have been exposed, they're paying more for health insurance credential information than an actual credit card. So I think that's kind of interesting. Okay, so let's get into, all right, the initial concept. During this paper, which was some work that took place in 2019, we did a feasibility paper on the use of chatbots in public health research. And it was during this research that we thought to include a very simple section in the paper, similar to how you may have your methods section and your discussion section, your conclusion section, your reference section. Why not have a cybersecurity risk assessment section if your study includes technology? And so we did a small little concept, and we added a section called cyber and other security threat concerns. And we thought this was important given the hypersensitivity and attention given to cybersecurity in the current day. We thought it'd be negligent if we didn't provide such a focus because we were introducing technology into this paper. So it was novel. It wasn't something the authors had done in the past. And we introduced nothing more than a simple likelihood and consequence grid, which is common in doing vulnerability assessments at a very high level. So what did we do? Well, we had several pieces in this project. We had, it was built on Amazon Web Services, and the solution, we had a backend piece, which was Amazon Web Services and Amazon Web Services Lex, and that we considered the remote attack surface. And then we had a local Java application as well. And that application, and I give credit to Samir Sweetie, who's, I don't know if he's on this session, he actually built these applications after they were envisioned. There were two major blocks. We had the server block and we had the local client block on our smartphone. So on our smartphone, we had an app that was talking to the server. All we did was we said, well, let's look at the top 3 security concerns we have for the backend server piece and the top 3 security concerns we have for the local client piece on our smartphone. And let's just determine if there's something we should be doing and be concerned about. But we had that initial idea and thought and concept. We just wrote it down and we said, all right, this might be something useful. And that's what led to us, documenting it. We got it published. And what were some of the goals in this? We said, well, we wanted to bring, confidence to those who might be using technology solutions in public health. If they know that there's been at least some assessment around cyber security, that would maybe bring greater confidence. We wanted to bring awareness that, for those doing pilots or large scale solutions in public health, that we should, at least those who may not be aware of the cybersecurity issues, we should actually bring some awareness there. And quite honestly, we just said, well, for those who may not be familiar, it's better to do something than actually nothing. And I think that was something that came out of that initial concept. So then that led to we have a current publication that hasn't been published yet. It's in hopefully final review. And we took that initial idea from the chatbot paper and built out a further proposed cybersecurity framework, all right? And in this framework, we call it a toolbox. And I'm going to go through its 7 steps. I'll go through the 7 steps, and you may look at them and say, well, that seems pretty obvious and reasonable. And the reason we wanted to keep it reasonable and a bit more approachable, it's a first step in getting public health professionals and researchers and scientists more aligned with thinking about cybersecurity risk assessment. So we did a literature review on digital, including digital health publications that included cybersecurity risk assessments. or computer security, we didn't find all that much. And so we said, wow, maybe we got to push on this a little bit. So we, rather than come up with a framework brand new, we said, let's use what the National Institutes of Standards and Technology have available through their cybersecurity framework, and maybe scale it down a little bit for digital health implementers, as a first step. All right, and so we proposed a theoretical model design. I'm grateful to Samia Ramarao, Dr. Yun, and Dr. Jung for assisting on this additional work. It's a good mix because I come from a cyber technical background. Dr. Ramarao comes from a public health background. Dr. Yun and Dr. Jung from a public administration background. So this mix of a team, we think, was valuable in getting this paper further developed and this concept further developed. Okay, step one. For those who may not be familiar with building an application, an app or a device, there are different areas or activity areas. You can consider work at the concept phase. As you see in the bottom left there, you can consider work during the iteration inception phase, the construction phase, the transition phase, the production, or even retirement phase, right? We can't lose sight when you stop using an application or stop utilizing data. There are steps you should take to ensure that that data or that application doesn't get somehow exposed when it shouldn't. So an assessment can take place at any of the potential areas on this in these blocks. And so the first step is to, decide where are we and where should we put a focus, okay, on this assessment. Second step is sit down, this seems so obvious, but introduce the concept of the risk assessment with the entire public health team, not just the technology people, but those who are the research scientists, the medical professionals. Let's get down, at a table and just try to get everyone at least understanding the same language. And I think it's important partly because if you look at some of the general public health curriculum, unlike computer science and information technology disciplines, there isn't a whole lot around cybersecurity in their curriculum. And so I think it's important, and it's a service that I think those in cybersecurity should bring forward. It'll improve the way, as I said, the team communicates, and very important, this last bullet here, allow for greater future embracing of cybersecurity as a core theme in global public health projects, all right? So here is the NIST. These are the NIST functions from the cybersecurity framework, and they have basically 5 main functions. One is to identify, one is to protect, one is detect, one is respond, and one is recover. And these are the main functions in the framework. We decided to say for those building these applications or envisioning these digital health or mHealth or eHealth applications, let's focus on the identify and protect areas and leave the detect, respond, and recover for the information technology specialists and engineers. So that's the first thing to do, is determine which part we want to pursue. And that comes out of the conversation, with regard to sitting at the table, and you can go through multiple functions, but you start with perhaps your riskiest area or what you consider your riskiest area. The next thing to do, the next thing to do is then determine on one of the categories. There's multiple categories in the framework. And there's, in this case, I put an example. Well, let's say it's an application that has permissions and authorizations that are managed. So what does that mean? That means users are assigned certain permissions and ability to view data or run an application or basically access or operate on the data or in the system, but you limit the access permissions. So one thing to do is to then say, all right, you know what, we're concerned about that. We're not sure in this system if we put safeguards in to be sure that those who are maybe using it or operating it, let's say at, a digital health or a clinic, a health facility, a public health facility. Let's ensure that we've done our best that, in regards to limiting the access and the ability that they would have in the system. So you can say, all right, let's look at that as a focus, all right? And then you would then drill down, you'll sit down, you would note the top 3 threats or concerns, similar to what we did in this original chatbot paper. If there is a remote or local attack surface, remember the remote could be something as the back-end system, think Amazon Web Services, think cloud, that would be a remote attack surface, and list out the top 3 concerns for the local attack surface, whether it's a tablet, a PC, a smartphone. And again, get those listed out, at least in a conversation. You're doing more than you would have if you didn't even approach that. So step 6, you would then create any sort of likelihood and consequence grid that you feel. This is a very simple one, but you can create, this is where, there's no particular design. Different groups can create different heat maps, for example, with different color-coded boxes. You can be creative with that, but rank them into the likelihood and consequence grid. And then based on that, sit down, and this is where you may need to consult others about what should be done, if anything, and modify to try to minimize any of the threats that you've thought about, right? So it's like, all right, well, we've outlined what we think are the top concerns for this section of the application or the system or the area that we think is risky. What can we do about it? Is there anything we can do about it? Do we need to talk to others? Do we need to do more research? But do something before just releasing it if there are concerns. And that's where having a team involved is important as well. Then, if it's applicable, return to the top of the workflow and go ahead and do it again with the next step in the life cycle. You can pick, you could do this at the beginning of a project. Ideally, if you're starting at the concept phase of a new digital solution, it would be great to do this as you go through each of the different pieces of the life cycle. You can then go through, let's say you have an application you purchased already. You could go through this as well in some degree. And I think you might have to rely on the vendor for some of the information, but it is possible as well. But again, follow some sort of workflow, some process in focusing on the cyber issues. And quite frankly, given the fact that we're seeing so many vulnerabilities exposed in digital health solutions and mHealth solutions, I think this would be a start. It'd be great to see the number drop and see less in the way of vulnerabilities being exposed, but and really compromised. But that is the goal. So call to action, right, on the cybersecurity front. So there's limited amount of literature found with regard to digital health and cybersecurity. I think further exploring the public health curriculum, to see if including cybersecurity topics might be beneficial. We've considered the idea of a campaign to bring greater awareness to this topic. I think greater contributions from industry and academia. We have a research project that we just started here at Kane University with some graduate students, where we're taking this idea and now we're basically surveying organizations to learn a little bit more. We want to actually use this framework, this prototype framework, this proposed framework in some real life situations. We've done it on the theoretical perspective, right, for now, but we haven't gone and actually done it on a system that's going live and in production. So we want to see where we can collaborate a bit more. A call to action for global public health implementers and researchers to include risk and vulnerability analysis during their projects, right? We've said that. This is an important one. The National Library of Medicine medical subject headings, right? This is in PubMed. They don't have a cybersecurity search term. They've got a bunch of other terms, but not cybersecurity. So we want to request that this term be added. And, exploring, this idea of further research into this field. All right. Let's see, limitations. A couple things. We focused on the cybersecurity framework, the NIST cybersecurity framework. There are others out there that we could have utilized, but we decided to go with the one from NIST, which is quite widely used and accepted. We focused our literature research on PubMed. There are many other journals that we could have researched, but we put our attention on PubMed, but that was a limitation. And as I just mentioned, the next potential step is to apply this to an actual public health research project, creating a technology solution. Really quickly, and then we can get to some Q&A or any comments or feedback. So some do's and don'ts, right? When it comes to cybersecurity, and I say this not just for public health, but it could be for, quite honestly, all of us, right? Think like a cyber criminal. And what I mean by that is, if you are, exposing systems or information or data that, would be likely targeted by a cyber criminal, you might be compromised. And I think that's something to, put yourself in that frame. Well, hey, I'm going to build this and make it available and store data unencrypted, for example, sensitive data. Well, put your cyber criminal hat on and think, well, it may not be such a great idea because I might be exposing very sensitive data and put me in some hot water. Bring awareness to your public health teams or any research teams. Casey mentioned doing research with Johns Hopkins may not necessarily be public health related. It could be other type of work. And I think you should just bring awareness if you can about this. You should implement a secure development lifecycle. And real important, this last one on the bottom left, innovate. You want to continue to be innovative, but be selectively look at the cyber perception as well, right? Selective cyber perception. Okay, I'm going to innovate, but in the back of your mind, you're always thinking, all right, am I introducing problems, right? And how can I kind of avoid that? Don't do nothing. This issue is not going to go away. You have to do something. You don't have to be a cybersecurity expert. I hope you see from the framework, we've tried to make it so that you can approach this and feel confident in approaching cybersecurity from a perspective, maybe not at the low, man in the middle attacks where you're looking at digital traffic and trying to get down into the real nitty gritty, but let's think about it at least from the perspective that we're continuing to grow our awareness and knowledge around cybersecurity. Don't rush products out the door and don't go at it alone. I think and that's what's kind of important here with all the work that we've done here is to, you get groups together, you get different perspectives. If you need to ask because you're not sure about a technology, bring it forward to your teams. We have some references, and I think that is, I probably talked more than I wanted to, and I think I talked maybe a little quickly, but I understand it is late in the day. But I want to, take any questions or comments. Happy to answer anything and do my best. And I want to thank you for taking the time to stop and discuss this topic for a short amount of time.
Thank you, Stan. I have a, maybe, there we go, a little bit of feedback. Maybe you can mute yourself, Stan.
Yeah. Okay.
Okay. One comment, a couple questions for you. Great to see the interdisciplinary nature of your work. You mentioned public administration, criminal justice, public health, computer science. Obviously, cybersecurity cuts across all of that. So that's just an observation. One thing in your do's part, you said, think like a cyber criminal. What might be helpful for folks is to Google the term adversarial mindset, right? This is the sort of the subfield, not even really field, subcategory within cybersecurity that gets at some of the, the thinking of a cyber criminal, which can be really difficult for folks who don't think like criminals, like most people, right? Don't really do that naturally. I'm curious, I had a question about your feasibility paper. What kind of feedback did you get about adding the cyber and other security threat concerns section?
Yeah, can you hear me? Yeah. Hold on, am I muted here? No. Okay, good. So very interesting because it was novel. In the original paper, the chatbot paper, it wasn't rejected. They actually welcomed it in the paper, and that was through an outlet that does lots of work around health data and big data, and that was the journal that we published that paper in. They were open to it. Now, but it's a great point, Casey, because we've tried it on another paper through a collaboration, and they said, no, we don't want that section. That's not part of our, strategy. That is not part of our structure. You take that out. So we did get some pushback from another paper. Now, I'm hoping with this most recent publication, once it gets out the door, I hope that this might be approached a little bit more. But so we're, I guess, 50-50 so far with two papers. Why do you ask that? That because is that?
It's interesting to me. I think it's really, it's a novel idea, and it's really pushing the research community to start thinking about this, right? I mean, one of your takeaways there was that people need to start thinking about, I think it was the whole innovating with selective cyber perception, just thinking about if you're going to be implementing something with technology, you really need to think about risk and vulnerability. And, I come out of private industry, and for the most part, folks honestly don't, security is an afterthought, right? It's just, let's get the product out as fast as we can. And, in the mid-90s, with the advent of the internet, the whole software quality assurance model change. It's the users become our QA, and we're just gonna, we'll just push out updates, right? So let's just get it out as fast as we can. And so that's just a huge sort of inertia that I feel like you have to battle in the software development space. And then, so I don't know. I thought it was a cool idea and really novel, and interested to, especially with sort of maybe older, more mature publications, I would guess that there probably would have been some pushback, but I wasn't sure.
Yeah, great point. And I think we would continue to get that, but we may need to target particular, we can continue to get our foot in the door with publications, and so we'll see. I think I would feel better with a publication where I included some digital health solution or digital solution in general, knowing that the authors did a little bit of homework and research and a checkpoint on cybersecurity. I think I would give it a little bit more credence, but I guess time will tell, Casey.
It's interesting. Talk a little bit about, one of the things you really sort of undergirds this effort is really, really wanting to bring awareness, right? You use that term a couple times, right? To public health folks. Are there groups? What are those groups? How do we get in front of the folks that are supporting the public health researchers? Because that was the role I was in. I was a statistician and programmer. I was a lowly research assistant supporting senior researchers, right? But we were writing software and implementing the technologies, and we were the ones that were really, for the most part, responsible in supporting the researchers in the field. And so, how do we get to those folks?
Yeah, great point. And we've talked about it and brainstormed a little bit about that topic. And one approach, and we don't know how well this would be received either, is get to the foundations or those who are giving out the money for research work. So for example, If I am a foundation and I have a call for research proposals, asking about digital solutions, make it a requirement that as part of the funding that you receive, include a component around cybersecurity. I think it's a bit unfair to say, well, build a solution, do it any way you want, and then end up having to clean up some issues because they rushed it out or because they didn't have the resources. I think if you can do it at the level where you ensure there's some resources, because quite honestly, for a lot of organizations, and it could be academia or research-based nonprofits, funding is not so easy. And to say, well, we're going to have to do a cyber risk assessment, well, it just means, well, we need more time and more experience and more, perhaps some funding. So I think it may get cut somewhere along the way. But if we can get to those at the, that are putting out these call for proposals, maybe that's a way to entertain and get this introduced.
An interesting idea. And who are the big funders, right? Is USAID still a big funder in this space? And who are some of those folks?
Yeah.
And that's really sort of a procurement issue, right? You get to the procurement people at these funding agencies. What you're saying is to make this a requirement of the funding, which I think is absolutely would change behavior, right? It would make people.
Yeah, you're right. And we do have hopes that once this paper is, knock on wood, gets published, that we can then approach some venues to give it some more attention. AID, I think, is still, I'm kind of a little bit out of the loop on the donor side on, right now, but I know just recently from reading, I know USAID has made lots of, I believe it was $900 million for global activities around COVID-19. So that was, certainly one. NIH, to the extent that they have funding still available, that's another area. The likes of the Gates Foundation, I think they like to use technology as well. That's another big one. Ford Foundation, it may take speaking to some of these outlets that provide, magazines or monthly newsletters to foundations. If we can get on their agenda to at least bring this forward, maybe that's a way of contacting all of them. But I think that's a good point. I'm glad you're raising this, Casey, because that's thinking ahead a little bit further.
Well, it's your idea. I'm sort of amplifying it, and it is, and anything that's going to force people to change their behavior, right? Because, either folks really they don't have the cybersecurity expertise, right, to integrate it in the technology, or if nobody's really forcing them, most folks are going to take the path of least resistance, right? So interesting. Are there any questions for Stan?
Hi, it's Tammy Allen.
Hi, Tammy.
Are you guys still on?
Hey.
Yes.
Okay. So is it okay if I ask a question about Venue Foundation's work? And I'm sure other institutions are doing something similar to what we're doing, where we're building our solution on top of an existing infrastructure, right? So we're building a digital learning hub for healthcare workers on the Salesforce community platform. So my question for cybersecurity is, can we rely on the security measures that a behemoth like Salesforce already has in place to protect our, customized community that exists on top of their platform? Or do we need to look at additional enhanced security measures specifically for our data, which lives on the Salesforce cloud?
Yeah. Great question, Tammy, and thank you. And thanks for being on this webinar.
Yeah, no, thank you. It's great.
Yeah,
Congratulations.
This is, so a couple thoughts. Number one, because Salesforce is being used, I don't think they're going to allow us to do any sort of, hacking against their system that probably would be really not acceptable. So it might be around sitting down as we did in this, and maybe we could do that with this proposed framework and just determine what we think are some of the risks. And then we approach Salesforce on their part. The other aspect, if there was any custom development, which I think there is and was,
Yeah.
that's another section that might be a little bit more in the way of, introducing risk as well, but we would have to approach. So I think there's two pieces, or maybe even three.
Okay.
If there's an app created or there's an app used, which
Right.
there is as well. So I think we would sit down and maybe go through the process and
Use the toolbox.
the toolbox, and maybe we see what we uncover, and then we bring it forward. I think we would have to contact Salesforce for some of those responses.
Of course.
I think also too, Tammy, Salesforce has been around a long time. They're, an early software as a service cloud provider. They've got really good people working with them. So, generally speaking, I think they've got mature security services and solutions.
Right.
They're not, everybody is hackable and right. And so but generally speaking, they're going to have the sort of expertise that would be hard to replicate sort of within your own group, right?
Right. I'm so
So-
glad to hear you say that, because, we invested in using Salesforce as opposed to smaller, newer, cheaper solutions, because I thought, hook our small wagon to the big star, which is already, way on the cutting edge and always doing new releases and
That's right.
surveillance. So I thought we could, piggyback on their functions, including security.
Absolutely. And Stan's point about, you with software, so with the cloud providers, if they're providing the infrastructure or the software, whatever they're providing, there is going to be only so much that you can do, right, in terms of having insight into their security practices. But Stan's point about if you're writing your own software or you're administering your own systems and whatnot, that's a different story, right? And you might have a lot more control.
Responsibility too, though.
Absolutely.
Yeah, that's an important point too, Tammy and Casey, is that even though it's, their solution, it's still the risk is right with the user in some degree, right? The way you're using it certainly can introduce risk, but we just can't wash our hands and say, oh no, they handle all the risk because you're actually using it. You have to bear some of the risk as well.
Definitely. Okay. Thank you. That's really helpful.
Thank you. Great question. Well, we're a couple minutes over. I want to be respectful of people's time. So Stan, thank you very much. I really appreciate you taking the time and just and sharing your expertise, and also just being a stand really for trying to push the field forward, right? And in doing these interesting novel things that are, like including, a whole cyber and other security threat concerns section in a feasibility paper, and really, thinking about how can we integrate cybersecurity content within existing public health curricula, and how do we get in front of the people. So, really thank you for being a stand for, in that way. And also thanks to all of you for joining, and check your inbox for future webcast invitations, and of course links to today's recording and presentation slide deck. And thank you for all you're doing to keep yourself, your family, and others safe and healthy. And we'll see you next time. Take care.
Bye. Thanks everyone. Thanks, Casey.